This is DW News Africa. Coming up on the program, why have African countries been so successful at combating HIV? And is that about to change? That's the fear after the United States imposes massive cuts on its international aid programs. Also coming up, star author Chimamanda Ngozi Adichie visits her hometown in Nigeria as part of her international book tour. And she sits down with DW to talk about her new book, Dream Count. I'm Michael Oku. Welcome to the program. Why have African countries been so good at combating HIV? A new UNAIDS report highlights amazing progress in the fight against the virus since 2010. And sub-Saharan Africa leads that progress. It achieved a 56% reduction in new HIV infections, the steepest drop globally. Drill down into the detail and you find countries that are beacons of hope. They've managed to ensure that most people living with HIV know their status and are getting the drugs they need so the virus in their bodies is under control. Countries like Botswana, Es-watini, Lesotho, Namibia, Rwanda, Zambia, and Zimbabwe. But that progress has been uneven. Of all the people in the world who need anti-HIV medication but are not getting it, almost half of them are in the sub-Saharan countries where so much progress has been made. Much of that progress was due to one of America's most successful exports, PEPFAR, the President's Emergency Plan for AIDS Relief. Since it was launched in 2003, it is estimated to have saved 25 million lives, mostly in sub-Saharan Africa. But now that's under dire threat. U.S. President Donald Trump announced a freeze in funding earlier this year. What might that mean if it were made permanent? We'll be putting that question to the head of UNAIDS in a moment. But first, here is one perspective from Es-watini, one of the countries that has made progress, yet is dependent for much of that through PEPFAR.
Most of us from this rural community, we do not have the money to access all the services that are provided in the clinics. But when we are together, motivating each other to access the service, the people are capacitated to go and get the service. We need these education sessions where we get the correct information so that we are on the right track.
I'd like to welcome Winnie Byanyima, the Executive Director of UNAIDS, who joins us from Johannesburg and whose staffers, we should mention, are on the front lines of this issue. Winnie, welcome.
Thank you for having me.
Our pleasure. Following Washington's cuts, what are you anticipating for HIV/AIDS programs in Africa, especially in those countries that rely heavily on U.S. support?
The progress that the world had been making over the years, reducing new infections, reducing deaths, is at huge risk with the sudden withdrawal of the largest donor, the United States. The risks are huge. We see countries fighting to step in and replace the resources that have been removed, developing countries, but we see that these efforts still need the support of all the countries of the world. The story of global solidarity must stay. We need the United States and all the other donors to stay the course because we were going to reach the end of AIDS. There are wonderful innovations out there that can make us move fastest to reduce new infections down to zero and come to see the end of AIDS. But it won't happen unless we have the global solidarity.
Winnie, you say that the risks are huge. Can you put that in very real, practical terms? What exactly does that mean?
Absolutely. What we see now is that many clinics have been shut, workers have been laid off, and communities who had contracts to serve their own people in communities, contracts were closed. So now we see in many places fewer people showing up for a test, fewer people coming to get what they need for prevention, like PrEP or condoms. And so we see new infections rising. We had 3,500 new infections every day globally before this disruption. Today, we estimate that to be at about
I'd like to welcome Winnie Byanyima, the Executive Director of UNAIDS, who joins us from Johannesburg and whose staffers, we should mention, are on the front lines of this issue. Winnie, welcome.
Thank you for having me.
Our pleasure. Following Washington's cuts, what are you anticipating for HIV/AIDS programs in Africa, especially in those countries that rely heavily on U.S. support?
The progress that the world had been making over the years, reducing new infections, reducing deaths, is at huge risk with the sudden withdrawal of the largest donor, the United States. The risks are huge. We see countries fighting to step in and replace the resources that have been removed, developing countries, but we see that these efforts still need the support of all the countries of the world. The story of global solidarity must stay. We need the United States and all the other donors to stay the course because we were going to reach the end of AIDS. There are wonderful innovations out there that can make us move fastest to reduce new infections down to zero and come to see the end of AIDS. But it won't happen unless we have the global solidarity.
Winnie, you say that the risks are huge. Can you put that in very real, practical terms? What exactly does that mean?
Absolutely. What we see now is that many clinics have been shut, workers have been laid off, and communities who had contracts to serve their own people in communities, contracts were closed. So now we see in many places fewer people showing up for a test, fewer people coming to get what they need for prevention, like PrEP or condoms. And so we see new infections rising. We had 3,500 new infections every day globally before this disruption. Today, we estimate that to be at about 5,800 new infections daily. We see that if this hole is not plugged, we could have 6 million more new infections in addition to the 1.3 that we had last year in the next 4 years. We could have 4 million more deaths by 2029. This would really mean that we are off course. We are not on the way towards ending this disease, and yet we could.
You're saying that we could have more deaths, and the year that you just mentioned was 2029. But surely we're thinking even beyond that. How bad could this get? Are we talking about millions, tens of millions? Give us some perspective of deaths here.
I have said that deaths could increase by up to 4 million in the next 4 years. Well, to give you a perspective, last year we had 630,000 AIDS-related deaths. So you're talking that in the next 4 years, you could quadruple this and even more. So you're talking of seeing people dying again visibly, because right now it is more like a chronic illness. If you are tested early and you take your medicine, you will be fine. You can live a long life. We have people who've been on treatment more than 40 years now. No, not 40, for more than 30 years now. So it's possible to keep people alive. It's possible to turn off the tap of new infections, but we need the world to come together and stay on course. Developing countries are already doing a lot. They are supporting their own responses even in a situation of fiscal constraints, like high debt and sustainability, like tax dodging that drains the domestic revenues that they would be able to collect. Even in those circumstances, we're seeing them stepping in to try to increase their resources. But we need the other side to step up, because this is a global pandemic. It is not going to fester in one part of the world and just stay there. It will come back to haunt everybody. That's why the collective effort is important. It's global.
We should make it clear to our viewers that these programs that are at risk support people on a daily or weekly basis, people who are taking drugs. And part of the issue here, I take it, is consistency really matters with the HIV drugs people are taking across Africa. At worst, the funding cuts cut that lifeline and at best disrupt people's regimens. Can you explain more about that?
You're absolutely right, Michael. You see, when people are tested and they are HIV positive and they get onto the antiretroviral, their viral load is suppressed. You cannot detect the virus in their blood. Then they don't transmit. They are safe. But once they stop taking their drugs, it can take a matter of days or a few weeks before the virus is back in the blood system and they are now able to transmit to others. So they become infectious. Secondly, when they stop taking their drugs, if they come back later, their drug resistance grows. The same drugs that others are using now become less and less effective because people are on and off them. They are not consistent. So in both ways, we get a reversal, a real reversal with more transmission because people are now not virally suppressed. And you get drug resistance, that people are taking the drug, but they are not suppressed because they are resisting the drug. So it's dangerous. It is risky. We need to keep the 31.6 million people in the world who are on treatment today, to keep them on treatment. And we need to find another 9.2 who are not yet on treatment and get them on treatment. And it's not just a financial issue, Michael. It's also a rights issue. We see that this sudden removal of resources is also accompanied by a pushback on rights, on laws, on policies that enable people to have access to what they want, what they need. This pushback itself means that many people who could get what they need are hiding at home because they fear stigma and discrimination and criminal laws. Yeah.
So what practical steps can governments or local organizations in Africa take to keep HIV/AIDS services going?
Well, the governments, this disease is concentrated in Africa, not because Africans are particularly in any different from others, but because of the conditions, the inequalities that continent faces, that for 12 years, they never had the antiretrovirals that made everybody safe in Europe, in America. They continued to have more and more people infected, and these inequalities remain. We need to see those countries prioritize the health of their people, reallocate more for health spending as donors step away, but we also need them to create the enabling environment, repeal those laws that criminalize people for same-sex relations, for gender expression, repeal those laws, or at least do not enforce them punitively so that people can come forward and work with community leaders. For the donor countries, we say to them, this is a global problem and you have a responsibility. This is not about charity. It's about making the world safe for everybody. Continue putting your resources into this and work on the real issues that stop Africa from having the domestic resources they need. Get the debt to move towards a sustainable level, the debt restructuring that they agreed to move quickly in Sevilla, the Financing for Development Conference just 2 weeks ago, passed the Convention on Global Tax Collaboration, which is there at the UN, and several of the rich countries are dragging their feet, don't want to support the end to tax dodging that cheats Africa of $88 billion annually. Companies taking out money without paying their taxes, most of it went to the rich north. So those are some of the things they need to do that are structuring the economy and that free resources in addition to the aid resources.
Winnie, a difficult question, but I think a practical one. What do you say to people who argue this episode tells us African countries should stop expecting handouts, as they would put it, start fostering less dependence on single major donors like the U.S., and generally be more self-reliant?
You know, I find that actually offensive because it assumes that developing countries, African countries, are sitting there receiving and not doing anything for themselves. That's not true. First of all, as I said, this is a global pandemic. We don't even know where it came from. It may not even have started in Africa. But when it hits a part of the world that doesn't have enough resources to fight immediately, then it spreads like a fire. That's what happened in Africa. When they made antiretrovirals, we were denied them. And that's not about charity. That's about making a life-saving treatment available for everyone to buy to be able to save themselves. So a global pandemic needs a global solution. If you do not solve it together, it will still come back to haunt you. It will fester in the poorest region, but it will come back to haunt you. So there is no question that developing countries are not putting in their best. In fact, they put in more of their resources than is acknowledged. Their hospitals, their health workers, their social workers are all working on this disease. But you do need the other countries where the disease also came from to put on their share so that we solve the problem. South Africa, where I am, has been a leader in global research on HIV. When they pulled away their money, the Americans, South Africa has continued to lead in innovating on vaccines, on investing in a cure, by partnering with the Gates Foundation, partnering with Wellcome Trust to continue the global research. That research is for the whole world, not just South Africa. So really, it is wrong to look at a global problem like it is a charity to help countries that are still lagging behind. They lag behind because there are structural inequalities in the global economy that don't enable them to collect all the resources that are due to them that could help them end this pandemic. So really, it's not charity. It's global solidarity. Global problems need global solutions. That is our point. And right now, our report says that there is a major disruption that needs all the countries to come hands on deck to get us back on track to end this disease by 2030. It's still possible. There are new medicines that can help us move faster. There are new treatments and new prevention tools.
You've been director since 2019, overseeing dedicated people who interface with desperate people. How's all this affected you?
Deeply. But I have to say that all the work I've been doing for many years have been about challenging injustice and challenging social and economic inequalities. I find them so strong here in the field of health, where you see...
Winnie, I have to interrupt you. I have to interrupt you because I read that you actually considered leaving your position because you were so emotionally distressed by the fact that Washington had decided to cut off aid. Is that true?
No, I didn't think of leaving my position, but I was very, very, very disappointed. It was the cruelest thing to do, to take away life-saving medicines from people when actually it's just a 0 point something of your budget. 0 point. It's not 1%. So to me, it was unnecessary. It was sudden. It didn't give the countries the respect they deserve to plan, to organize a takeover of the support they were getting. It was disappointing. But for me, I approach problems by just being hands-on. I don't run away from problems. And I'm right here doing all the things I need to do to keep this response on course. So we are delivering what we have to deliver as we are also hurting and laying off people. It's very, very painful, the situation we are in, but let me tell you, not more painful than it is for that gay man hiding from the law in Uganda, or that young girl in South Africa who is afraid of going to do a test, yet she thinks she may have slept with someone with HIV. These are the real stories of pain, and ours is to fight alongside them. And it makes me feel, yeah, I'm doing what I need to do. And in a way, it gives me fulfillment to be standing with them.
Okay, we'll end it there. That's Winnie Byanyima, the Executive Director of UNAIDS. Many, many thanks to you.
Thank you.